he said to me, should we try going back to Canada? But this time, let's go on the West Coast because I've heard so many great things about the West Coast. So let's go to the West Coast. We'll spend a couple of years and before coming back. At the time, I was working when I went back to London, I was working for St. Mary's in Paddington. I worked in the emergency department. And that's when I went on to the PEDS ICU. So I spent about 4 years there in total in between the Emerge and PEDS at St. Mary's. But things were becoming a bit tough. The work was really heavy. It was becoming very heavy. We had a lot of staffing shortages, and also there was some moments I wasn't feeling very safe going home late at night, or early in the morning, leaving early in the morning. And when my husband and when we were speaking, and he said, "Let's go back to Canada," and I said, "Yeah," but then he suggested the West Coast. I applied directly to the BC Children's Hospital, and they contacted me and said, "Okay, you're already a pediatric ICU nurse. You can come directly to our pediatric ICU." In Toronto, there were a lot of hoops at the time because I had a work permit. When you have a work permit, at that time, every 6 months, I had to renew it. And then I realized that instead of having to go through this every 6 months, I had to get the employer to send a letter. I applied for a permanent residency. I qualified for it because I had stayed there long enough to apply for permanent residency. After applying for that and receiving it, I had come back to England. But when I was going back to Vancouver, I had my permanent residency, which allowed me to enter the country. And then I had to be present in Canada for 5 years straight, continuously, before applying for my Canadian citizenship.
Okay.
So I applied for my Canadian citizenship and took the exam, and now I'm a citizen as well. And Canada allows you to be a dual citizen, so I'm allowed to keep my British citizenship with my Canadian citizenship. The Ministry of Health looked into some issues of that it was taking much longer for nurses and doctors and any health professional actually, and they realized that they needed to help to make the process, speed up the process. So the process is now much better, it's much faster to apply. When I read about BC, they promoted safety on the streets and this work-life balance, which I was chasing after because I wanted to have this, be able to work, but also to have a good leisurely time outside of work. And so all those things attracted me to when I read up about BC Children's and about BC on the whole. So while I was doing that research, I wasn't as nervous or anxious as I normally am because I was like, this looks like a really good place. And it looks so beautiful. And it was even more beautiful when I arrived. I am really passionate about my job. Very positive, upbeat person. And one of the things about me is that I connect with most of the people within the hospital. So that I love. I connect with the staff I work with on the unit, and I always look to build relationships so that, I feel like if you build a good relationship with staff, you have a much better working environment because it becomes positive as well. And so I am passionate and I love my job a lot. And you could tell when I get in daily, I'm always upbeat, and even without caffeine, I'm always on the go and being happy and pleasant and, trying to help staff to get through their days, even if it's a busy day. We have different outlets that staff can talk about things that are feel they're affecting. So they can connect with the team of educators. Then we have the operational leads or clinical nurse coordinators, even our program manager. We all operate with an open door policy. so that people could feel that they can walk in and speak about any issues that they have. Also, people can we daily on if they have concerns or they're feeling they want to advocate for their patients or at the patient rounds. We tend to be respectful of each other and raise things there. We also have conferences, like case conferences. So we discuss certain patients and things we could have done better or things that didn't go so well. And people can come there as well and speak about issues or, anything going on with a patient that they weren't able to be heard about. So we have several different places that people can actually speak about issues that they have at the bedside. I've had many opportunities, and then this opportunity came along to do where the ministry provided a sum of money for a project to teach how to care for critically ill children across the province. So that because BC, as you know, is very big, and sometimes it takes a while to get the children to our center because of weather or several different reasons. So if we help people to learn about how to care for children in remote areas with minimal resources, they can feel more confident until the child comes to our unit. So I travel. I've been so we just did Vancouver Island. We went to the hospital in Nanaimo, and then all the other hospitals on the island traveled to Nanaimo. They sent staff to Nanaimo for that education. And we run the education over 2 full days of teaching. We teach many, many things. So how to sedate children for different reasons, what to use for intubations. Like it's a huge project. And I've also been to Prince George, which is in the Northern Health region. And we have been locally we did the Fraser Health, some teaching in the Fraser Health. And when I go back, just a few days later, I'll be going to Kamloops, which is in the interior, to do some teaching. So I do travel quite a bit with my job. In BC, we have more resources. And so at first, when I got there, I was like, oh, I don't have to do all of this. And they're like, oh, no, you have a therapist who's going to be working with you. I'm like, oh, okay. So they actually, which takes out a huge chunk of some of the work we did that I would have done here. We're paid much, much more over there compared to here. I think my pay actually doubled, depending on the level of the patient, the level of what they need. They could be two patients to one nurse. And I know the government of BC are just working on a proposal of they're going to actually mandate patient to staff ratios, and so they're going to make it much less. It's mostly going to affect the adult world or the patients that on the wards, because we are mostly one-to-one anyway. But they're going to mandate that the nurse would have a smaller amount of patients. I have a hobby of running at 4 a.m. with my husband. So we get up in the morning, we go for a run, and we get ready and go to work. And honestly, it gives me so much energy for my day. My shifts are much better when I run and compared to when I'm not. And then we do, what's fascinating about BC is as you're driving to work, you can see the mountains because the mountains are right there. And it's just so beautiful. It just makes you feel really good going into work. And while you're at work, you just look out the window and you can see the mountains. So that's one of the appealing things for me. We hike a lot, we bike a lot. And there's so many trails. There's the beaches, you can go and hang out. There are many, many pools open to swimming. We have lots of community centers, and they're not very expensive. And you can go to the gym there. You can go to the pool. You can do the sauna, the steam room, for a very, very small fee. And they're dotted around Vancouver. I have done kayaking, so we go to Deep Cove to kayak. I've gone to Whistler for skiing and haven't done snowboarding yet, but many of my friends do. Squamish is a very popular site to go to. There are lots of lakes as well that are beautiful that people just go and do paddle boarding. So Alice Lake, which is in Squamish. Um, Tofino is a popular windsurfing area, and many people go there. Like many of the staff, a lot of staff, we have a social group, and so people get together and we do things outside of work. I would say do it, do it. It's a great. I feel like people should try living somewhere else because you get to see a different. You get to see. Okay, so for me. The lifestyle was so different because I'd never been such an outdoor sports person until I got to BC. I got to meet so many different cultures that I've never experienced before. Um, and you just you get to learn a lot about yourself, like how you handle change. That was one of the huge things for me too. And I am a person that can handle change now just because I've moved and you have to meet new people, and even meeting new people is a bit of a challenge because you're like, oh, I'm feeling a bit shy with how would they accept me, but it's been very easy settling in on the unit, and with the hospital on the whole, because people are very friendly, and they staff would go out of their way to make sure that you feel a part of the culture of BC.